Warrior here. I recently went through an open heart surgery, and prior to and after surgery, I was looking for online and content from folks who have gone through surgery to hear about their experiences. Though I could find a lot of content from professionals that is available online, but I couldn't find much of any content or the videos shared by folks who have actually gone through the surgery. So I decided to create my own videos and share my experience for the benefit of others. This video I will try to focus on issues I had and tests I did before the surgery. I will come up with a few additional videos to discuss my experience during and after surgery, but for now, this is only about my experience before the surgery. Stay tuned to hear about my story. To my issues related to my heart and my symptoms around it, some background or some details about me. I'm in late 40s. I have no weight or blood pressure or sugar issues. I had no, sugar issues prior to surgery, and I still don't have those issues. I'm fairly healthy and fit. Well, I think I'm fit and healthy. I exercised, but not enough to prevent heart issue, obviously. My diet is healthy. I don't eat red meat. I rarely eat any greasy food. I will say I don't eat a lot of greens, though I eat a lot of fruits. Overall, person with a healthy diet, except, occasional overdose of chocolates, say I indulge myself in. No cholesterol medicine prior to surgery. My overall cholesterol has been hovering around 200 um, for at least last 7 years, as far as I know, I guess. My PCP never told me to go on a statin, but though I was given a statin for a few months, and I'll talk about it in the later slides, but overall, I never had a consistent statin medicine before the surgery. And just about the surgery, I went through the CABG or open heart surgery like 3 months back. CABG stands for coronary artery bypass surgery, and they did a 3 grafts. So it's sometimes referred as a CABG tree. All right, so that's a little bit of a details about me. Next, let's get into the my symptoms and why I had to go to the cardiologist. My symptoms. This was a year back. I always consider myself as a very healthy individual, so I didn't thought I had any heart problems. But the earliest indication that something was wrong was a year back. One of the days I was partying. I mean, I won't consider it a partying, but I was hanging out with the friends late night that day, and I ate spicy food very late, like 2 a.m. or something like that. I mean, I usually don't eat food so late, but the food was awesome, so I couldn't resist eating it so late. The next day, I had a pain in my upper stomach area, just like when you have a acidity issue or a gas issue. I had similar kind of a stomach trouble when I went through the appendix, so I thought it was a gas issue or something like that. But I couldn't get out of the bed. I was so feeling tired. I didn't have a lot of energy. I was sweating all over. So that day, I think I almost slept in throughout the day. The next day, I felt way better. I almost was back to normal. But I knew something was wrong, but I didn't thought much about it. As I mean, as I thought, it's mostly around the stomach related thing. Well, I forgot about this incident till I kind of noticed that shortness of breath while climbing stairs or while running on a treadmill. I could easily just run through a one flight of stairs without even feeling a shortness of breath, but now I was suddenly feeling, I have a shortness of breath. Even while on the treadmill, even after running for a few seconds, I was feeling shortness of breath. So obviously, that kind of indicated to me that something was wrong. Of breath, I started worrying a little bit about it. I wanted to kind of be normal, like walk normal, run normal, I guess. I usually avoid going to the doctor, but this time I decided to go to the PCP. I mean, I couldn't get appointment with my regular PCP, but his assistant who did a EKG test, and she said it was fine. But she did refer me to the cardiologist, and as usual, getting appointment with the specialist is sometimes takes time. So, I mean, I got appointment, I think after 2 months or something like that. And in the meantime, I went on a week's overseas trip. And after the trip, and I think it was, a few weeks after the trip, I went to see the cardiologist. He, he did few things, tests on me. Like I think they did EKG or something. I don't really remember, but he did check my heart and I think my pulse on the neck. And he did said that you're coming from overseas trip. You did a lot of walking and everything. If you had a heart attack or anything, you would have not been in my room over here. So he said, there's nothing much to worry. But then he referred me to the heart echo test and the stress test. He also suggested I do the calcium test if I want to, though they don't really go with that calcium test. But I said, I agreed with it because it was a not so expensive test. Echo test is very simple test. It kind of looks at how your heart is doing. It is a non-invasive. Only uncomfortable part about a test is the cold room and the lotion they put on your body, but otherwise it's kind of very simple test. Stress test is where they it involves a little bit of exercise. They want you run on a treadmill or elliptical, so that your heart rate is above 145 for a few minutes. It's a little bit of a stretching yourself, and I felt like it is a little bit of a, I won't say dangerous, but some kind of a concerning test for me if somebody is not having heart issues. I don't know how they really do the stress test. But I survived that test. I was able to, get my heartbeat to 145, do the whatever they asked me to do. But I still, felt it was a little bit of a dangerous test. Few days later, my echo test results came back fine. There was nothing wrong with my heart valves and everything. Stress test, when I looked at my doctor's website, or a cardiologist website, they had some notes on the stress test, but my cardiologist office didn't call me back with any concerns. So I didn't follow up with my cardiologist around the stress test. Calcium test also showed elevated calcium for my age, but I don't think it was very concerning. But since my doctor had said the calcium tests are not something a good indicator of the heart issue, so I kind of not really got into it. But what I'm not sure is why my cardiologist didn't call me back about the stress test. So maybe they got too busy and they didn't thought too much about it. I don't know. But nothing was done after the stress test and echo test. My cardiologist left that as, you know, they didn't follow up for another appointment, or neither I followed for a appointment. One quick note, echo tests and stress tests are expensive. I think my insurance, since I had not met deductible, was around 1K. So though, I mean, I don't exactly remember exact numbers, but I think it was 1K or more, 1,000 or more than that. Calcium test is very cheap. It only cost me $100. Not covered by insurance, so yeah, you have to pay it out of pocket. But also, be aware that calcium test is not something that the cardiologist could rely on. So it's good, something that you probably want to know, especially if you don't want to do a lot expensive tests, but just want to understand, if there is a calcium buildup. I think probably that you can go. This is not a doctor's advice, but just my thoughts on this. So that's kind of my initial test a year back. But let's fast forward to this year now. This year, by this time, I got used to shortness of breath. I thought it was more related to my stomach issue. I was having some stomach issues, like stomach aches and things like that. And I didn't thought about it as a heart issue. So I was pushing myself to run faster and longer. Started feeling better. But then this summer I got sick with cold and a mild fever. Um, I mean, initially I thought it was just a fever, but during this time I started experiencing shortness of breath again. It was a little bit different than what I was experiencing earlier. First, I thought it was tied to the fever because, like when you have fever, you feel a little bit tired, exhausted. So I thought it was tied to that. But then the shortness of breath persisted even after a few days, and the fever was gone. Again, this year I had planned the overseas trip. It was coming up within a few weeks. So I decided to see cardiologist because, who wants to go overseas and get sick over there, right? Nobody to call or nobody to reach out to, and you don't have insurance. So I decided to go to see cardiologist. Um, my regular cardiologist was not there, so I think his assistant. I got appointment with assistant. I think I was lucky to get an assistant appointment the same day. She did a ECG on me. Initially, she thought when she came to the room, she's like, "Oh, I don't think there's much wrong with you." But then I started talking to her, why I'm getting shortness of breath. So she decided to look at the ECG again, and then she suddenly was like, "You need to go to the emergency." I think it was more driven by what she was seeing in ECG, but not necessarily just that. But also, I kept on talking about my symptoms around the shortness of breath. So I think she kind of was trying to make sure that she is putting me through the right test. So she asked me to go to the emergency. Um, that was kind of very scary for me. So I refused to go to the emergency. And I suggested and requested to her if I can take some test in outside the emergency. So their office had some the test that I could do. So she referred me to the echo test. Again, I had done one echo test last year. And she also referred me for a CT scan in another hospital. So echo test was normal. As I said earlier, it's an easy test. The CT scan test, where they inject the dye using IV, it's not very invasive. If you're okay with the needles, it's not so painful. So that was a CT scan test. I went to the hospital. They injected dye into my arteries with IV. Um, they give you this dye which makes you feel like you're peeing in your pants within a few minutes of the dye getting into the arteries. But it lasts for a few minutes, so not to worry about it. They told me about the that side effect, so I was not worried about it. It was a very quick test. I feel like, not super quick, but I think I was altogether at the most 1 hour in that hospital setting. It's not like you have to actually admit in your hospital, just outpatient test under the CT scanner. Um, I went home. I drove myself back home. Next day, the doctor called me saying the CT scan test was inconclusive, but they saw some blockages. She didn't say blockages, but she said they saw some shadows which can be, the blockages. So she said that that the test was inconclusive, and referred me to angiogram test. So she suggested I do the angiogram test to make sure that we are looking at everything. Our office helped me to schedule angiogram test. It was part of our same hospital facility, or their company. It took on my insurance like a day or so to approve it. So I got appointment 2 days after they started looking for the appointment. By this time, I'd actually started feeling normal, but I suspect the aspirin helped a lot to reduce my shortness of breath, and that probably that aspirin sometimes I think is really a lifesaver. So maybe you should ask your doctor if you're feeling bad, and if you cannot get appointments, try to see if you can take aspirin. But that I feel like aspirin helped me a lot to reduce my shortness of breath. All right, so this is a lot about my recurrence of the symptoms. Let's go and talk about the angiogram in the next slide. All right, doctor's office scheduled an angiogram test, right? But it took a couple of days for my insurance to approve the procedure, as I said earlier. So by this time, I was feeling better, but at the same time, I was worrying. I know something was not right with me, or something was not really right. Um, in the meantime, I started researching about angiogram test and realized more like outpatient procedure. Usually, hospital will discharge you on the same day or the next day. I had a trip coming up, so I had not canceled it. I was waiting on results of this angiogram test. I thought, I know, I'll rather push it by a few weeks if I had to, but I had not canceled by the time. Hospital, I mean, in the meantime, it's very funny actually. The hospital had sent me instructions about the test, and one of the note was that I can do a valet. I mean, I can valet my car. I thought this means I can drive back myself, right? Otherwise, why they are saying that you can valet the car? Which obviously is not possible because this test involves sedation. I mean, this involves anesthesia. So I'll talk about it in a minute. But when I called the hospital, they were like, you cannot drive. You'll need somebody to drive you back. So I had my friend driving me to the hospital, and he waited on me on there. Right. On the day of the test, I had given myself 2 to 4 hours in the hospital if they don't find any blockages. Right. In the worst case scenario, I was thinking they'll put a stent in my arteries. I was prepared for it, and I thought I'll be able to travel in a few weeks if they put the stent. I don't remember, but I think I had to fast and stop taking aspirin on that day. I think they don't want the blood thinners to be in the system that day because they will try to go through the arteries and find blockages. So test does involve anesthesia, so be aware of that. You'll need somebody to be with you and drive you back and give you a little bit of moral support, right? In the hospital, they ask you to change into the hospital clothes and everything. They took me in the operation theater. The nurses and technicians were having a lot of fun over there. They were actually loud and some jokes were inappropriate. I felt like that. I mean, on the lighter side, I think they don't have a human resources department there, or maybe just the nurses are, the technicians are just used to jokes. But overall, the whole atmosphere made me feel relaxed. I was, just trying to take my mind off what test is going there. I was trying to focus, not trying to focus there. I was sedated partially. I was semi-conscious. I could see part of the things that what they were doing, but not everything. So they put me on the operation theater, and then they put I think they try to get into your arteries, try to see the blockage by putting a very tiny, to simplify, I think there was a tiny wires with the cameras on it. So they did what they had to do for a few minutes, and after a few minutes, they shut down the operation theater lights. Suddenly, I felt everything in the room got to serious. I mean, they were joking and all of that before. I don't know if they were joking during the surgery. I was half sedated at that point in time, but when they put the light off, I think I was a little bit more conscious at that point in time. Um, but suddenly, I felt they all of them were serious. Cardiologist or surgeon at that point in time told me that I have blockages, and he is not suggesting angioplasty. Angioplasty is not recommended for me. Um, she said he will transfer me into the holding room and we'll discuss the next steps there. Well, I mean, that was a big shock for me. I was prepared for the stents. Worst case scenario for me was angioplasty. They will put a stent and will let me go home, end of the day or the next day. I was prepared for that. But now they were like, we cannot do angioplasty. They will talk about the next steps, and they moved me into the holding room. I mean, I started panicking and really started getting anxious over there. The friend who had, was with me, he joined me in that holding room. That kind of helped a little bit. Um, we started talking and all of that. In the holding room, it was funny that there were some other, the companies that doing some research. They come and try to get you to do some of this research, join the research during the surgery and all of that. And I'm like, I'm going through my own own anxiety there, and I'm like, I'm not participating in your research there. But that was funny that they tried to kind of sell you those research things. I mean, obviously they need to research, so they can include that as as part of the regular procedures. Well, that was part of my angioplasty test. That turned into the big surprise for me because my worst case scenario, as I said, was I will be walking out of the hospital same day or next day. But now I was in the holding room, not knowing what is in store for me. I will talk about what happened in that holding room in the next video. But before I end this video, I just want to note: make sure you drive someone, you drive with someone to angiogram test. It's an invasive test. It will need someone to drive you back home. Also, the cost of the test is, I think it was more than $1,000 with my insurance. I think I don't exactly remember, but it was, I paid at least 1,000 plus. But that met my deductible, so whatever was on top of it was paid by insurance. So based on your insurance coverage, it is an experienced procedure. It also will include cutting the wrist. So I believe you'll not be able to do a lot of things with whichever wrist they use to get through to your arteries. You will not be able to do a lot of things with that wrist for a few days. But in the meantime, I'm hoping you are able to get some insight into what I went through and relate it to how you're experiencing it. If you have gone through the heart surgery, or if you have a planned heart surgery, you will probably um, this video will help you to understand some of the things that you have to go through before the surgery.